Hello and then hello. You're all welcome to the Health and Wellness Show. And my name is Miss Dale. Hope everybody's doing well. Okay, so as I just said, you're all welcome. This is the Health and Wellness Show. We talk about anything health and wellness that affects our life. So kindly share the link and invite everybody to come listen to it. You never know who this any message or anything we discuss here might benefit. So we're trying to save lives and save ourselves as well. So we're learning as we go on this channel, on this program. We bring healthcare professionals who come on here to talk to us about our health and well-being. So any topic in healthcare and anything in wellness, anything that concerns our well-being, we talk about it here. So please invite people, share the link, and don't be selfish. All right. So welcome back. Today we're going to be talking about preventive health care. Preventive health care. All right. Okay. And our special guest in the studio today is Dr. James Doe. And then I'm going to add him in a little bit. Welcome, Doc.
Thank you. Thank you very much for having me.
You're welcome. So Dr. James Doe, he's a family medicine physician and he worked at the University of Texas medical branch as a primary care provider in Alvin, Texas. He sees patients in outpatient day clinic setting. He attended Bishop Herman College in Kwando in Ghana from 1982 to 1987 and St. Augustine's College, which is in Cape Coast, from 1987 to 1989. His medical training was at the School of Medical Sciences of Kwame Nkrumah University of Science and Technology, that's NUST, in Kumasi. If you're in Ghana, you know NUST. And KNUST, rather, yeah. He worked at the Koforidua Regional Hospital and Batok Catholic Hospital in Ghana as well. He completed his family medicine residency at the University of Oklahoma and family residency program in Tulsa, Oklahoma. Yeah. Since 2010, he has practiced as a family physician in various capacities. All right. So we can all deduce from what I just read that Doc is a very experienced and well trained person. So thank you, Doc, for being with us today.
Thank you very much.
Yeah. So, and as I introduced at the beginning, he's going to talk to us today about preventive healthcare. So, take it over, Doc.
Yeah, thank you very much. So, preventive health care. Before we go on, just English. I don't need to speak ever, right?
Yes, it's English.
Okay,
Yeah.
okay, okay. So, preventive health care is basically a visit you pay to your doctor at least once a year, and most insurances will pay for it. And the reason for doing that is to go see your doctor, establish a relationship with your doctor, and then the doctor will talk to you, ask you questions, and then try and figure out if there are any health problems that you need to take care of. Look at your family history or any issues that you need to take care of, so you don't get any health problems in the future. So, in short, that's the primary preventive health care, and it's very important to go see a doctor every year. When you go, typically, of course, every clinic visit, you get your vitals checked, and two big ones there are your weight and, of course, your blood pressure. And for we Black people, our blood pressure can be a problem. So if, say, you have a high blood pressure problem there, the doctor can pick it up. If your weight is on the upper side, the doctor can pick it up, and through that can help you uh, figure out how to keep yourself healthy so you prevent illness, or how to take care of any illness you have. Typically, the doctor will ask you a bunch of questions. Of course, your health problems. What do you do? How is your vision? Have you seen an eye doctor? Because if your eyes are gone, man, you don't see anything anymore. So you need to take care of that too. And then one important thing is family history. family history is very important because there are some health problems that you inherit from your family. If there's a family history of hypertension, diabetes, cholesterol, and all the cancers that you can think of, there's a predisposition if your family member has it. So the doctor will ask you about your family history just to look at those. The doctor also asks you whether you smoke. If you smoke, then you have to talk about the need to quit smoking. The doctor will ask you about your immunization status. What immunizations have you had? We do immunizations to prevent disease or to protect us from getting disease. And that's also very important. So, in short, this is the summary of what the encounter you do when you go to the primary care doctor. And in addition, at the end of it all, you do some blood work. And then from the blood work, of course, you can figure out a lot of stuff. If you're anemic, it will show on what we call your CBC. And anemia can be very common. Sometimes from what you eat, you are not eating adequate balanced diet, or you may be bleeding from somewhere you don't realize. Sometime in the gut, where you don't see frank blood, but it's what we call microscopic blood. So that's you check, the doctor checks that. Also, you can do checks your chemistry, your electrolytes, your kidney function, very important. If your kidney is gone, that means your incinerator in your body that helps get rid of toxins out of your body together with the liver. That means it's gone. Then you are in trouble. Then you need dialysis and stuff. So if anything is found, you prevent that so you don't end up on dialysis. One day. We check your cholesterol. Why do we check your cholesterol? The cholesterol is important because as we eat, we take a lot of cholesterol in our food. Okay, the cholesterol over many years clogs your blood vessels. When it clogs your blood vessels, you start to have problem with blood flow. Okay, and sometimes the plaque that are forming the circulation can break off. When it breaks off and clog anywhere, you have a big problem. If it's in your brain, you got a stroke right there. If it's in your heart, you got a heart attack. If it's in any organ, part of the organ can die. If it's in your legs, some people, you can get a cut off of blood flow to your feet. So in short, that's what we do. And then, of course, as in primary care, you advise your patient. For example, a patient may come and say, hey, my family has high blood pressure. My family has diabetes. How do I prevent this? I don't want to end up on medications. For high blood pressure, the number one uh, thing that correlates with your high blood pressure is your weight. So if your weight is, as your weight goes up, your blood pressure goes up. As your weight goes up. So the first advice would be to work on your weight. And what do you do to work on your weight? Exercise. Exercise does not mean go to the gym and lift all the weights there. It can be just brisk walking, 30 minutes a day around your neighborhood, during lunch break at work. Small things like that can actually control your weight better than just going to the gym and trying to push metals. And then generally you try to be active any opportunity you get. Be active, walk around, do stuff. When you get to any building, if your knees are not bugging you, take the stairs, take your time. If you go to the shopping mall, park your car at the back and take a few steps. These days you can get step counter to keep track on it. The cardiologist will tell you if you get about 7,000 steps a day is very good for you overall health. So that would be hypertension. Secondly, hypertension is also a factor of your family. If your dad has, my dad had hypertension, my mom has had hypertension, so I have hypertension. I've worked hard to bring down my weight, but I still have to take a pill. Why? Because the genetic component also plays a role. You can lose all the weight you want, but because of the genetic components, your blood pressure may still be a bit on the higher side. So if you go to your doctor and they give you medication, please take it. in our community, a lot of people, we don't like taking medication, especially the high blood pressure medication. The reason you need to take your blood pressure medication over for as prescribed, even if there's side effect, go talk to your doctor and he or she can change it for you. So when your high blood pressure, your blood pressure is high, it means your heart works harder than it should. It's doing overtime every day. Your heart pumps 72 times a minute. Calculate that. So if your heart is supposed to last you 70 years, 80 years, by 50 years, you got what? You got heart failure. By 50 years, you have kidney failure. Okay. And then you have changes in your brain and not in overall your body. So the blood pressure medication is supposed to control that blood pressure so it's not too high to cause damage in your body. Also, say you are diabetic or you have a family history of diabetic, the doctor will advise you, or you go to do the blood work and you are told you are pre-diabetic. We use what we call hemoglobin A1C to to diagnose diabetes. Diabetes usually 6.5 and above is considered diabetic. If you are around 5.7 to 6.4, you are considered pre-diabetic. So say you go see your doctor and you say, "Oh, you are pre-diabetic." So now then you have to take measures to prevent yourself from becoming diabetic. So what do? You eat better. When I say eat better, what do you? I know we as Ghanaians we like our kenke, akpalamonlu, fufu, and all that. Those are all carbohydrates, and diabetes is a result of not producing uh, in either type 1 not producing enough insulin, or type 2 maybe you are overweight or you have difficulty in producing sufficient insulin. So the doctor, of course, was advised you to change your diet a bit. So for we Ghanaians, if you eat two balls of cake, reduce it to one or half. If you eat two balls of akple, now reduce it to one. In place of that, eat more soup, eat more vegetables, eat more fish, more chicken. You moderate in meat. You moderate in meat, and your meat should be grilled. The more food you steam, the better. Uh, the more salad you eat, the better. That way, your the pressure you put on your body, giving your body too much carbohydrate or glucose. Carbohydrates is broken down into glucose, which the body manages. It's less, so you can control your sugar levels better. So the doctor will discuss this with you, and then your diet goes with exercise, because when you exercise, you can break down or metabolize your sugar better. In addition to also bringing down your blood pressure, because diabetes, high blood pressure, and then cholesterol, they are the big three that can cause serious health problems for you. So you start exercising, you eating better, and then the doctor will say come back 3 months or 6 months, depending on how the results went. Thirdly, the cholesterol. Cholesterol, I've mentioned already, is also very important. I've said it clogs your blood vessels. Uh, Now, when you are people who are when you are diabetic, uh, clogging of your blood vessels happen much faster than the general population. So you see, if anybody who is diabetic, when you go to see your doctor, your cholesterol may be reasonable, but your doctor will recommend putting you on cholesterol medication. And a lot of patients will say, "Ah, my cholesterol was normal. Why did the doctor put me on cholesterol medication?" These are usually explained to patients with diagrams, because what happens is, because you are diabetic, all of us we produce, or we lay plaques, which are like clogs in our blood vessel, right? But it's faster in diabetic patients. So that means a diabetic patient is more at risk of a stroke, heart attack, and kidney failure and stuff like that. The cholesterol medication you take, listen to me, the cholesterol medication you take is not only for the numbers on the lab result. The cholesterol medication stabilizes the plaques that line the blood vessels. It stabilizes them, keep them in place so they don't break off. Because when they break off, what happens? They go and clog a blood vessel, an artery. If it's in your brain, you get a stroke. It's in your eyes, you are blind in that eye. It's in your heart, you get a heart attack. In your feet, you may get amputated because you have acute ischemia, as we call it, blood stop flowing to your feet. So those are things that are important to me as a primary care doctor when you come and see me. The other thing is sleep. I know when we come to this country, we want to work long hours, but we are made such that we function better sleeping. Uh, at my age, 7 hours, even 6 hours would be good for me. In your 50s, in your 60s, as you grow older, generally, you sleep less and less and less as you grow older. But sleep what heals the body, rejuvenates the body. Uh, it rejuvenates the body and gets you ready to perform better the next day. So sleep is very important. So in our taking care of ourselves, we should always make sure we have enough sleep. A caveat I want to give: when you exercise is good for you. But when you exercise too close to your sleep time, you realize you go to bed, you can't sleep for long hours. So when you exercise, make sure you exercise about 3 hours or so from your sleep time, so that by the time you go to sleep, your body will be relaxed and you can sleep well. A few things about sleep. Uh, we call it sleep hygiene. Try to sleep about the same time every night. And when you're going to sleep, have yourself what we call ritual, something like that. Say for me, if I'm going to sleep, uh, I'll go shower. It tells my body, hey, I'm going to sleep. I brush my teeth. I take my pill, uh, and I get ready. Some people, so you may wear your pajamas if that's what you wear every night. That tells the body that, oh, it's that time we're going to sleep. So you develop that sleep hygiene. It makes it easier for you to sleep. Now, I know we work long hours. And some of us work uh, shifts, today day, today night. Some work night always. Generally, I tell my patient, we are not raccoons. We are made to sleep at night. So anytime you are staying long up at night, especially when you are advancing in age, you are kind of fighting the natural rhythm. So you have to make sure you sleep at night. Now, as you grow older, sleeping is difficult. So an advice you can give is to older patients, hey, try not to nap during the day. You may be in retirement, but don't sit behind the TV and nap. What will happen is in the night, you can't sleep. Go out and do stuff. Those are some of the advices one will give. And the other advice I give my patient is information from social media. Patients tend to believe everything they see on social media. You have to make sure anything you see is from an authentic place. Don't stop your medication because you heard somebody on the social media saying cholesterol medication is not good for you, or metformin is not good for your diabetes, or have you heard this? Please talk to your doctor. Because when you get a stroke, you get a heart attack, you get a kidney failure, it's you alone who is going to suffer with it, not that person who's screaming on social media. Talk to a doctor or somebody who is reputed and know what they are talking about. Also, hydration is very important. Hydration is very important. Uh, when you are in your 50s, your 60s, about half your body by weight is water. That's how important your water is. For ladies, it's about 60%. For children, as they grow, the younger they are, 80%, even babies around 90%. So hydration is very important. So we should all develop the culture of keeping ourselves uh, hydrated. If you drink a lot of alcohol, I'll talk to you to reduce it, because alcohol has a lot of consequences on the whole body. You smoke, we talk about smoking cessation and techniques and medications that can help you quit smoking. And please, when you go see a doctor and you have questions, write them down. My patients, especially my white patients who are older, they come with books, small books, with a lot of questions. Sometimes all they need is for you to sit there a minute and answer all their questions. They don't need medications. So please, if you have side effects, there's something going on, write it down. These days, you type on your phone, go ask the doctor instead of listening to somebody on social media. The other thing is cancer screening. When you come, we talk about cancer screening. If you have a family history of cancer screening, the way we screen it may be different. You may be screened earlier. For example, in women, if you have family history of mammogram, and say your mother or your auntie had it in earlier, let's say in the 40s, you may have to start screening earlier than the standard of around 40. um, and please, for our women, I know sometimes for us, we don't like, we say, oh, they'll press your breast, it hurts. I know it hurts. My patients complain always, but you don't want to be diagnosed with breast cancer. So for that little pain, I won't say little, but for that pain, I think it's worth it. Get a gynecologist who will work with you so that you can monitor that. And also for the pap smear for the ladies, it's very important. When a patient of mine gets breast cancer, it's a disaster. I have to go through with them with it. They go do all their treatment there, but they come to me, nausea, vomiting, I can't sleep. And then, so I beg you, if you're a lady, you've never done your mammogram, go do it, especially if you're paying the insurance. And this, even if you don't pay insurance, you can get that services. Also, colon cancer screening, that's for both men and women. This month is, last month was colon cancer screening month. Colon cancer is one of the higher cancers in we Black people. And my classmate died from colon cancer back in Ghana many years ago, and that has never left me. So please, colon cancer screening is important. Uh, when the screening used to be started at 50 years, and it was lowered to 45 because younger and younger people are getting colon cancer. The standard of uh, screening for colon cancer is what we call a colonoscopy. I've had my colonoscopies. You reach 45, your doctor will talk about it. And what the colonoscopy involves, you drinking some laxative to clear your gut, and the doctor, they will knock you out. The doctor goes through your rectum with a camera, and what they are looking for are polyps. Polyps are small growths that develop along the intestine. They take many years to become cancer. That's why when you have polyps, they say come back 3 years, come back 5 years, come back 10 years. So, and then when they get the polyps, they look under the microscope. There are different types of polyps. Some they will not cause cancer. Some in 5 years may lead to cancer. So that's why the colonoscopy is important, especially for we Black people. Colonoscopy is very common among us. The other way of checking is, I'm sure you've heard the cologa, which is the box they'll send to your house. You put a little poop in it and send it to the lab. What they do, they check for DNA of the polyp. If it's negative, great. You repeat it in 3 years. If it's positive, then you need a colonoscopy. Why? Because we want to go find the polyps and take them out. Because in 3 years, in 5 years, in 10 years, the polyps can become cancer. That's why we do it that way. And then when you do the colonoscopy, depending on the number of polyps that are seen, the doctor may say, oh, let's see you back in 3 years, in 5 years, in 10 years. There's a guideline they follow. Of course, those are the main things when it comes to cancer screening. Also, if you smoke, there's something we call lung cancer screening, where they do a low dose CT of your lung to make sure you don't have lung cancer, and they follow. So these are things we discuss generally as you come to to your preventive visit or wellness visit. Of course, for Ghanaians, there are a few things I would like to add. One, anti-malarials. Please, when you are going home, get in contact with your doctor and take your anti-malaria before you go back home. I just had a colleague who is Nigerian. He went to Nigeria. He thought he's a doctor, so he won't get sick. He came back, he ended up in the hospital for 2, 3 days. Please, we've been here for so long. When you are going home, take your anti-malaria, else you end up in the hospital when you come back. You'll be so sick, you won't believe it, that you are originally from Ghana. So please, always take your anti-malaria when you are going home to Ghana. Of course, also, one of the things I think we should be careful about as Ghanaians is as we grow older and we flying back home, it's a long distance. When you sit in one place, there's always the risk of your blood not flowing well in your legs and people develop blood clots. So when you go sit in that plane, figure a way to move your legs, do exercises sitting down so your blood does not slow down and get blood clots. Then also we'll talk about immunizations. Immunizations are very important. I know these days in this country, there's a lot going on by immunization. By immunization, like the flu shot, uh, you take it every year to prevent you from getting the flu. If you work in the health sector, it's very important because you are exposed to a lot of sick people. Now, the way sometimes people will say, oh, I took the shot, I still got the flu. Well, maybe you got the flu, but it was milder. Because when I take the flu shot and I get flu, I don't realize it because it's only my nose that's running. My family gets sick there. Oh, maybe I brought it home. I go check. Yes, I had a flu. Why? Because my body is protected, so I don't get very sick. So the flu shot is not going to stop you from getting the flu. It means it will reduce the severity of when you get the flu and prevents you from going to be hospitalized from getting the flu. And sometimes it's true, they make the flu vaccine a year ahead. They use statistics to figure out which virus may be showing up here next year. Sometimes they miss it a bit, but they cannot wait to the very end to produce it. So there's always cross reaction. No matter what happens that year, when you get the flu shot, there is some level of protection that you get. Uh, when I work back home, especially when I work in the children's ward, I saw a lot of measles. I saw a lot of, we also saw a lot of polio growing up, tuberculosis and all that. In this country, you don't see much of that because the immunization has been that successful. It has been that successful. So please, I know there's a lot of talk about immunization, but for me as a doctor who came from Ghana, third world, I saw measles in the children's ward, kids dying from measles. I saw kids with polio. I have even seen rabies and all that stuff, tuberculosis. In Bato, we always had a side ward filled with people with tuberculosis. Okay, I saw all that. And I came to this country, I rarely see those. For me, it's a sign that even statistically that the vaccination and immunizations work. You have to know the other side of it coming from back home to realize how effective it's been. Also, shingles. If you had chicken pox before, when you grow older, um, you are at risk of getting shingles. It's the same virus. It stays in your body. When you grow older, your immune system is down. You get stressed. You go get a big surgery, a lot of stress. Then you break out in shingles. Uh, please get a shingles shot because when you get shingles, some people the rash will be gone, but they get pain, burning pain. They can't even touch their shirts, touch their body. It hurts and it burns. So get your shingles shot if you have not got your shingles shot. And any other shot that has we always ask questions. If you have misgivings, ask your doctor, and they'll take time and explain it to you why we do we give those shots. So those are my my the things I would generally discuss uh, with my patient when they come. Now, if you're a woman, a lady, sometimes we may talk about bone scan when you come, because especially as you get postmenopausal, you're at risk of getting fractures. So I think I'll stop here. Uh, I've talked enough. Thank you.
Okay, Doc. All right. Thank you so much, Doc. So are you done with us, or you have
Yeah, yeah,
more?
I'm done with us. My final message is that, one, see a doctor once a year to check you out. Please, very important, especially if you pay for the insurance. You take your car for maintenance every 30,000 miles, and you think your body doesn't need maintenance. Your body needs maintenance. Go see the doctor, let the doctor check you out. It's to be good news. You go, the doctor doesn't find anything. Hey, thank God, I'm great. You go the next year, please. Number two, when you are prescribed medications, ask why and take them. If you have side effects, to go back to the doctor. Don't just throw them away and say, me, I'm not taking them. In our community, the big thing is a lot of our people get stroke, kidney failure, heart attack, because we stop our blood pressure and cholesterol medications. Please, if you have side effects, go back and discuss with the doctor. You don't want to end up with a stroke and paralyzed in bed. You become a burden to your family. You become your family lose as an important source of revenue to take care of the family. So that's it. So exercise is very important. Keep your weight down. It brings down your blood pressure. It brings down your cholesterol, prevents or control your diabetes. Makes you sleep better. Exercise helps with your stress. It helps you handle stress better. Hydration, and don't forget your anti-malaria. It's a big thing a lot of Ghanaians do. They go back home, they don't take their anti-malaria. You come back home, back to the US, you'll be very sick if you're not careful. So that's all. That's the summary I have.
Well said, Doc. Thank you so much. Yes, Doc is reminding us to make sure we go for our yearly checkups. Very important. So, and it's very true. Most of us Africans pay for our insurance. We don't even use it. We don't make use of it. A whole year, 365 days, we go and come, and then we just pay money. In the end, don't go check on ourselves, or we don't
Yes,
go to the doctor to check us to make sure we are okay, strong and healthy to continue working to be able to send that money back home or take care of ourselves and our families. So it's
sure.
very important. Very important. Thank you so much, Doc. And then you're also
Mhm.
reminding us anywhere we're traveling to outside or wherever you are, we make sure we take the medications that we're supposed to take to prevent any sickness, especially malaria. Those of us from
Mhm.
Africa, we know malaria is prevalent. So we have to make sure we are well or we are secured before we travel back home. Thank you so
Yes,
much, Doc. There's a whole lot that we took from your advices that you've given us and all that you've told us about preventive healthcare. And then when we go to our doctors too, we should be sure to ask questions. Something
yes,
that we
very
don't
important.
do often as well. We ask questions, even the medications that are prescribed. We need to ask the doctors why they are prescribing the medications. Okay,
Yes.
yeah. And Doc, one final question is how important it is to get second opinions, especially when you ask questions and the doctor is not able to really give you any good answer. You can see that the answer is a bit shaky. Is it okay to go seek for second opinion?
I'll say it's your right. You pay for the insurance. And if the doctor is not ready to talk to you, you find another doctor. And you find another doctor, and you'll be lucky you find a doctor where you can develop that relationship and trust. Because you need to trust your doctor. So when they talk to you, you have confidence in them. But if they seem not to have confidence, or they are in a rush to run out of the room, they don't want to sit down and talk to you a bit. Now, the insurance you pay for it, it's your right. You can switch your provider. It's your right. You should do that, I'll say, if you are not satisfied.
Yeah, okay. And then also, if let's say like for checks like the colonoscopy, mammogram, and
Yeah.
all that, if the doctor does not recommend it, can you ask for it?
Oh yeah, my white patient, they ask. So why, when am I starting this? When am I starting this? And you have to explain to them. You have to explain. For us, the breast cancer for our ladies is a big one. Generally, the Caucasians have a higher rate of breast cancer, but the black ladies are more likely to get severe form or die from it because I think we delay too much. That's part of the. So please ask, don't be shy. It's your right again to ask, when am I supposed to start my mammogram? If excuse me, say your mom or your aunt had breast cancer at a younger age, you may have to start it early. And sometimes even I send my patients for genetic testing if they've had like breast cancer in their family, ovarian cancer. You want to see if they have some genetics that predisposes them to the cancer. That helps their children and their descendants to know that, hey, we got a gene we need to keep an eye on. So that's very important. That the colonoscopy to the same.
All right then. Thank you so much, Dr. James Doe. We are privileged to have had you here on our show today on the Health and Wellness Show. Thank you so much. We are grateful unto you. Our viewers, thank you also for watching. This is a Health and Wellness Show on the Sienna Media TV or the channel on YouTube. So please share the link. The good thing about this is you can always go back and watch it. So share it, share the link to somebody you think might need it or you might benefit. I mean, it will benefit everybody.
Yes,
I
for
mean,
sure.
healthcare, there's no limit to healthcare. So please share the link. You can go back and watch it if you didn't have the time to be with us. There are other programs that run on this channel. On Fridays, DJ Mawanyega comes on with African Jazz for your Friday relaxation. And Saturday morning, we are here, the Health and Wellness Show, Eastern Time, 10:30, and then Central Standard Time, 9:30 a.m. And then after that, we have Efo Steve and Empress Mousy who also come our way with Sienna Talk Show. Yes, Sienna Talk Show. Right after that, we have Dulenio Bobobo coming all the way from Ghana, hosted by our very own Mama MFA. And then after that, we have Miss Strawberry. Miss Strawberry, yes. So that's it for Saturdays. And then Sundays, Miss Strawberry is by Dr. Wanyo, Davina, me, and Dr. Dogbe, and a lot of other people who join in to teach us our ever language. And then on Sunday, our sister Nicole comes our way with Afrique with talking about our culture back home and everything that pertains to it. So there are other shows that will be coming our way, but for now, these are the shows that run on this channel. So yeah, very interesting shows. So please share the link and always remember your health is your wealth. Your health is your wealth. Thank you so much once again, Dr. James Doe. We are privileged to
Thank
have
you.
had you here on the Health and Wellness Show. So until we come your way again next Saturday, stay strong and be healthy. All right, then. Bye-bye.
Bye. Thank you.
Bye.